When I first spoke to the doctor at breast screen, we were hopeful that I might get away with just a lumpectomy, but unfortunately, because of this finding of an extra area of cancer slightly outside of that area, a much bigger area of the breast would be involved. And so, for that reason, the surgeon's recommending mastectomy. Definitely, losing a boob is a pretty confronting thought for a woman my age, even one who's had a love-hate relationship with her boobs her whole life. But yeah, it was interesting. She spoke to me about the type of surgery that she would intend to do. So because there's a larger area involved and she would end up having to take about a third of the breast or more anyway, it makes sense that probably taking all the breast tissue is the best way to prevent a recurrence. But she did say that the area that it is, being a fair way away from the nipple, means that I can actually have a nipple and skin sparing procedure. So basically, I get the idea that she's going to be shelling out the breast, like kind of leaving it like an empty beanbag, I suppose, and shoving an implant in at the end. So instead of coming away with one breast missing, I'm kind of going to come away from the surgery with one Barbie boob, which is sort of going to have a fairly roundish shaped implant in it, riding fairly high, compared to the other one, which is going to be a bit like a Granny Mammy hanging down lower. And so I'm going to be a bit lopsided for a little while, I think. I can live with that. I can live with that. When we started talking about the implants and how I'll be lopsided for a little while, I had asked her actually, would it be an advantage to have an implant put in the other side at the same time to even them up. But she actually recommended waiting for a couple of years because she said it can take a couple of years for it to settle down and sort of hang a bit more naturally. And as well as that, if I need any post-operative radiotherapy or anything like that, that it might actually cause some scarring and affect the way that the breast implant sits. So it might change anyway. And so she recommended leave it for a couple of years before trying to even them up by putting an implant on the other side, because by that time you'll sort of know what you're dealing with in the long term as far as its position goes.